bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
If you have spider veins, you're not alone. Nearly half the women over 40 have varying degrees of spider veins. Hello again, and thanks for joining us. I'm Carla Showell-Lane. You're watching Comcast Newsmakers. In the studio with me this hour is Dr. Harriet Commente. She's a fellow of the American Academy of Dermatology, and today we're talking about spider veins. Thanks for joining us today.
It's my pleasure.
And I know your title means that you're board certified, correct?
By the American Academy of Dermatology,
okay.
Correct.
So explain to us, if you will, Dr. Commente, what are spider veins?
Spider veins are those blue or red tiny veins that many people see on their legs as they get to be an adult.
Okay.
And they generally can run in families, although many of them are caused by trauma as well or injury.
All right. And how are they different from varicose veins?
It's a question of size. Varicose veins are much larger. Spider veins are tinier.
Okay, so we're looking at a before and after. And does it depend on the severity of how they are or how they should be treated by what they look like?
Definitely. Generally speaking, sclerotherapy is used to treat superficial veins, ones that we could see on the surface of the leg.
Okay.
Varicosities, there is a deeper system that may require surgical intervention, such as stripping and general anesthesia.
Okay. Are they painful?
Is the treatment painful, or
yes.
are the veins? The veins may be painful at times. They can throb, and especially after standing long days, they hurt. They physically hurt. But after the treatment, that discomfort should resolve.
Okay. And you talk about the treatment. I guess the treatment depends on how skilled your doctor actually is. Is that correct?
Correct.
Okay.
Correct.
All right.
And that's very important. So you want to check, when you go in for a consultation to your doctor, you want to check the photographs of their patients, both before and after photographs.
Okay. Now, can a person feel this? I'm just looking at the injection that is made right here.
It's actually quite painless.
Okay.
Most people are very comfortable and joking and talking as it's being done. The few patients that are needle phobic may require some oral medication, but otherwise it's extremely painless. The medicine that's injected is an anesthetic, so it's a numbing medicine, and it's really no problem for almost everybody. So
the recovery process in that little area that you were shooting that needle in, is it going to show some like black or blue marks or anything like that?
Some bruising.
Okay.
You're injuring the walls of the vessel, so they collapse and go away. There's no recovery really. We put on a support hose immediately after the treatment. We ask that a patient walk for about an hour and avoid strenuous exercise, but generally you could get right back to your normal activities immediately.
Okay. I heard that if you take hot or cold showers, I don't know if this is a myth, but if you take hot or cold showers, that depends on whether or not you get spider veins. Is that true?
Well, heat increases vein size and makes veins larger, but they don't cause spider veins.
Okay. What about diet or exercise?
Well, to avoid development of spider veins or more, although there may be a genetic tendency, you really want to stay your normal weight, you want to exercise, and you want to avoid standing in one position for a long period of time.
All right. Do you know if black women or men get spider veins as often?
Absolutely.
Really?
I've treated people of all colors and ethnicities. Anybody can get spider veins.
All right. So how should we create that dialogue to make ourselves a little bit more comfortable? Because no one wants to talk about spider veins, but with the doctor, what should we be asking?
I think you need to go to a physician who's trained and has been doing this procedure for a while. Most of the time people come to me or are aware of it when summer rolls around and they put on shorts. Or they're uncomfortable wearing shorts or bathing suits. And that's a good time to have a consultation. But actually a treatment's best probably in the fall, so you can have a period of time where you heal from the procedure. If you need to, there is a little bit of bruising, and so you'd want to do the treatment in the fall. But of course, if you don't wear shorts or a bathing suit, you can do the treatment anytime.
Right, exactly.
You'll be covered.
Yeah, there you go. The fall is coming up, so we'll take that into account. Thanks so much for joining us. Very important information. This hour's newsmaker has been Dr. Harriet Commente. She's the fellow of the American Academy of Dermatology. I'm Carla Showell-Lane with Comcast Newsmakers, an exclusive production of Comcast.